So Anne, as coordinator of Restore, can you tell us a little bit about the scope of the project?
Sure. Restore is an implementation science project. It's funded by the European Union Framework 7 programme. The funding award was for 2.9 million, and the purpose of the work was to investigate strategies that can improve the implementation of guidelines and training initiatives into healthcare settings. Our focus in Restore is on guidelines and training initiatives that have been designed to improve communication between migrants and healthcare providers in primary care. Restore involves a unique combination of contemporary social theory, normalisation process theory, and we're combining that theory with a participatory research approach, participatory learning and action research. And our goal has been to generate empirical data across a number of settings about the complexity of implementation processes, and to see if we can support and shape the implementation journeys of the set of guidelines and training initiatives. We've conducted fieldwork in Ireland, England, the Netherlands, Austria and Crete, and then all of that fieldwork has been complemented by health policy analysis by our colleagues in Scotland.
Okay, so Restore then obviously involved a lot of different service users. Could you tell us something about the service users that were involved?
Yeah, I mean, this is a participatory research approach, so involving service users was an absolute priority. What we're interested in is that service users have expertise that needs to be brought to bear on practice change and policy development. So in Restore in Ireland, we sought the involvement of established migrants, many of whom were involved in advocacy work for migrant communities, and some of whom were community interpreters. And these service users then worked alongside other key stakeholders, for example general practitioners and also health service planners, and they worked together in this participatory process for 2 years and 4 months.
Wow.
And they worked together to drive forward the implementation of guidelines and training initiatives.
Wow, it's very sustained collaborative work then over a long period of time.
Yeah, it has been, and it's been really one of the most exciting features of the Restore project.
Okay, thank you, Anne. So Marion Thomas, as participatory learning and action research practitioners and trainers, can you tell us what is PLA?
Okay, well, PLA is a form of emancipatory action research.
Okay.
And it's a very innovative, rigorous research methodology with a very strong focus on community engagement and user involvement. So it was really perfect for Restore.
Yeah, and I think historically as well, vulnerable or marginal populations or hard to reach groups, as it were, have been missing from the stakeholder table.
Okay.
And their perspectives haven't really been represented.
Yes.
So I think research in primary care has been incomplete in that regard. So there are gaps there.
Okay, okay. So maybe you could tell us a little bit then about the principles and pragmatics of PLA.
Sure, okay, so the principles and pragmatics of PLA involve key reversals in the research process. So, and there are many of those, but I'll just talk about 2 now.
Okay.
And the first of those would be from a very dominating attitude and behaviour, mainly on the part of researchers and academics. And it's the shift away from that, the reversal from the dominating towards the empowering. And the whole idea is to empower stakeholder service users to really engage in the whole process and have their voices heard.
Okay.
So it's about sharing power with rather than exerting power over.
Okay.
The second one would be about the shift from centralised decision making, again, located in the research team and the academics, usually the powerful groups.
Yes, yeah.
And the shift away from that into a decentralised and democratic decision making process within the research itself.
Okay. So if you were to think maybe of a concrete example from Restore, how would that translate into an example?
Okay, so how would that principle translate into a practical situation?
Exactly.
Okay, really good question. So a very good example, I think, would be direct ranking.
Okay.
This is where in Restore we had to choose a guideline or an initiative that could be implemented by the stakeholder service users in the Irish setting. Now, that decision could have come, but didn't come, from the academics in a top-down kind of way. In fact, the intention was to hand over completely to the service users, and using a PLA technique that we call direct ranking, give them the power to actually make the choice, having assessed a number of guidelines and training initiatives, to make the choice about the one that they felt would really work well in the Irish setting. Is that a good example?
Yeah.
Okay.
It sounds fascinating.
Yeah, it is fascinating. I mean, so I hope you can see really how PLA can really bring the service user perspective right into the heart of the research. And in this way, we would expect to be able to fill some of those gaps in primary healthcare research.
Yes.
And this perspective, the service user perspective, is a core perspective we simply can't afford to be without in our primary care research.
Yes, absolutely, I agree with that.
Okay. So, Marta and Katja, you've been involved in Restore research for 2 years and 4 months. So, as a service user, why did you get involved in the first place, Marta?
I heard about the project from other service users, people who were involved in the previous project with the same researchers. The other project was called Supers, and the feedback was fantastic. So I knew that would be something I would be interested in myself. And also because I'm a Polish person living in Ireland, I'm aware of the needs that Polish people have, especially when they access healthcare services in Ireland. So in a way, these are matters very close to my heart, and I knew immediately I wanted to be a part of something that's exciting, but also very important.
Okay, that's great. And for you, Katja, why did you get involved in the first place?
I got involved because I worked with the same team on the previous project. It was Supers project, and I was already aware of PLA technique, PLA kind of research. So I found this kind of research very innovative and very inclusive. So, and when I got the invitation to participate in this research, I just jumped straight in because I saw an exciting opportunity in participating again.
Okay, so an exciting opportunity for you, and you dive straight in on the say-so of other people, the interest of other people, obviously.
Exactly.
Okay, great. So the second question I wanted to ask was about direct ranking, and we've already mentioned direct ranking and PLA technique. I just wanted to ask, for you, what was it like from your perspective to be involved in that technique, to be doing that technique?
For me, from my own perspective, this technique worked really well for myself in the way I was actually making the decision. We were choosing a guideline and being able to listen to other stakeholders, both community interpreters and doctors and policymakers and other service users, getting their own perspective on the subject and the challenges they face. I think I felt that the decision I was making was maybe a better one, because the choice I was making was I was more aware of why I was making this choice.
So was it like your choice was informed by other stakeholders' perspectives?
Exactly. It was very helpful to be able to listen to people who may have had completely different views on my own original view. And also I think it was very interesting that at that stage, as a team, we were able to make a decision together about how the project would go, what would be the next stage, that we, the ordinary people, were actually given an opportunity to decide what next, which one we will choose, and where it will take us further. I thought that was very interesting.
Okay, that's very interesting. So for you, Katja, being involved in the direct ranking and choosing the guideline and voting and all that kind of stuff, what was that like from your perspective?
From my perspective, it's the perfect exercise of democracy because we had to discuss, study and pick one of 5 training initiatives. So we're all given equal opportunity to discuss it, to express our opinions, and then we're given equal opportunity to vote. But what was very interesting in this exercise is that our decisions were shaped by others' opinions. So we were not left on our own to make this decision to pick one initiative, we were we made our decision collectively, but the decision was ours. We felt like it was our decision, but we also had to take on board other people's opinion. So I think this is a perfect exercise of democracy, and I really believe that this is supposed to be a model for other initiatives and other research projects as well.
Okay, that's a pretty strong opinion. It's a very clear sense that you have about the possibilities there of that kind of work. Okay. So is it okay to go on to the next one? The next question? Okay,
Yeah.
Great, right. So it's kind of related because I was just going to say that PLA seems quite different from other types of research approaches, and I was just wondering what you thought about that.
Completely different to what you would think when you hear the word research. I think usually as people who are not academics, when we hear the word research, we think something scientific, something very obscure almost and difficult to understand, and not something that we would be actively taking part in. And this type of research is very different in a way that it brings people from different walks of life, in a way very ordinary people, and enables them to be part of it, to take an active part in the research. So in a way it's very respectful, and I like the idea of it.
Okay.
It's very inclusive, and also I think it works great because we are a team at all stages. So whatever we do, whichever stage we go through, we go as a team. So even if we face any challenges, we come up with solutions, and we do it together, and we always have at every stage perspectives of all the stakeholders involved, which might be very different at times.
Okay, so yes, so you had more to say.
Yeah, I just have one more thing that
Yeah.
I just remember now, that in a way we make very big and important decisions, but the way we are making them is very effortless. So to the point that I think Katja will agree with me, that we even had fun during our sessions,
Okay.
but at the same time we were achieving certain goals and making those big decisions, and I think that was very enjoyable as well.
And you said effortless. That's
And
an interesting
effortless.
word. Yes. Okay, great stuff. Thank you, Marta. Katja, for you.
Yeah, I agree with Marta. It was an effortless way to communicate with other stakeholders because there are different people were involved, and we all sat together and we had an open discussion. We made important decisions together despite our maybe different ethnical, cultural, language backgrounds. So, like for example, for me, I have a nursing background, and I used to have this understanding of nursing-patient relationship. When medical practitioners have nothing to do with patients, we just have to implement somebody else's decisions. So when we had the GPs, representatives, in our group, it was actually very interesting to interact with them, because sometimes we didn't realize that they also have problems. GPs also wanted to know our opinion. So, and it was very open. It was beneficial for every single person that was involved in the decision process in our research. So, the word that I picked for the research to describe it is revolutionary. Because I think that this is how most of decisions have to be made, in any kind of setting. Because this is the way of bringing people together and to decide collectively. So it's not a top-bottom approach. It's a very, very inclusive and participating.
Okay, so the way that PLA kind of brings people together to learn from each other, to share opinions, and then to make decisions collectively, as you say.
Yeah,
You believe there's...
Yeah, so just one more thing to say. There were no specific set of questions like in other research. Maybe sometimes you just have to answer questions.
Yeah.
There were no specific set. So we created as we went along, and I think that was very important.
I also wish to add that regarding the techniques themselves in the project, I think that was very interesting for us, because when we think about the research within maybe long questionnaires or somebody speaking for a long time,
And instead we were using lots of
instead we were
pictures and
using
charts and things like this.
posters and stickers
Yeah.
and making little notes, or going to the board and putting something on the
On the timeline or on the
comments.
mapping. Or
Exactly. So So this is again coming back to that word, the word effortless, that we're achieving things, but in a very different way to what we would think when we think about research.
Okay.
Um,